Hello, my name is Zhang. I'm a professor of environmental global health at Duke University. I have been working on air pollution health effects studies for several decades. Recently, I have been working on indoor air intervention to reduce air pollution exposure and improve health. I have recently done several small-scale intervention studies of using air purifiers indoors in people with different health status. For example, we have conducted a study in Shanghai in which we recruited children with asthma and having them to use air purifiers with the HEPA filter for 2 weeks. And we find that this intervention improved asthma symptoms, improved the airway mechanics, which means air can move or flow more easily in the lungs of these children with the asthma. And the finding is that the intervention was effective in helping asthma children. Then based on that study, we are now conducting 2 trials in older adults in Los Angeles, where air pollution levels are higher than many other U.S. cities and locations. So in those 2 studies, we focus on people with pre-existing health risks. In one group, where we recruited people that are obese or overweight, so they are at risk for developing type 2 diabetes. So in this study, we use a 6-month air purifier, again using HEPA filters, in their homes, and we're monitoring their health status related to cardiometabolic outcomes. And we hope that this trial will tell us whether this longer-term intervention will improve health outcomes of those people. In another study, we recruited people with a history of heart disease, and similar design but longer intervention time, 9 months of using HEPA air purifiers in the homes. And we're continuously monitoring their blood pressure, their other outcomes related to the cardiovascular health. And at the conclusion of the study, we hope to find out whether this intervention will slow down their cardiovascular, especially on the thrombosis risk, because they are at risk for heart attack or stroke. And if we see this intervention lower the risk for this event, that would be a big public health benefits. So we focus on indoor air because although the source of the fine particles, we call PM 2.5, is mainly coming from outside in the places that we're doing this interventions in Shanghai or Los Angeles. Because outdoor air, we cannot really effectively mitigate at the personal level. But indoor environment, we can have engineering intervention, technology intervention. In this case, is the HEPA air purifier. So considering that people spent a vast majority of time indoors, for example, in our Los Angeles subjects, they are spending more than 85% of the time at home, indoors, but also at home because they're retired people. So if if we can reduce the indoor fine particle levels, that means we will reduce the overall exposure to air pollution. And one way to really monitor whether the air purifiers can effectively reduce the exposure is to monitor concentrations for PM2.5. And thanks to the recent advancement in low-cost sensor technology, that we will be able to really put a sensor, those things cost a few $100s, in each participant's home, and then we will have a real-time reading of their indoor PM2.5 levels, so we will know they're actually, whether the air purifiers work. And also at an end, we can assess whether the reduction of PM2.5 is associated with the improvements in the health outcomes. So wildfire generate air pollution. Very high levels of fine particles, PM2.5, that's the target of this air purification intervention. And there are two reasons why we try to intervene. The exposure during the wildfire episodes are particularly important at the present and in the future time. One is that wildfire frequency and intensity has been increasing globally. Of course, certain parts of the United States, for example, West Coast, we see, those fires happening more often, and also the fires are bigger. So then during the wildfire episodes, the outdoor concentrations are tens or even higher than the PM2.5 levels during the typical time. So those very high levels, they will get inside homes. Without air purification, the indoor levels will be normally 70%, 80% of outdoor levels, so still very high. So we know that acute exposure to very high levels of air pollution is very toxic. We have had old days when the extensive coal-powered industry activities generate the levels are similar to wildfire-generated air pollution levels. So we know that we had a lot of data to show those times that the mortality, the death rate goes up when those episodes come up. We now have some data to show during the wildfire episodes, hospital admissions, emergency room visits counts are going up. So how we really try to reduce that exposure? Again, simple technology. Indoors, we use air purifiers that effectively reduce the levels of PM2.5. That's why I think this is really very important, because the wildfires are now become so frequent, and every year, we're going to see this. To our participants in those two studies, HEPA air purifier intervention studies in Los Angeles, I really want to thank you for your time and interest in this project. You're participating in those trials will generate data to provide evidence that will help us to make recommendations for future to a larger, community or even clinical practice that can recommend this intervention as a preventive measure of people's health.